Hi everyone, so I am Sumreen and today we will be studying about narcotics and controlled drug regulations. So what are the things that we have to keep in mind regarding the drugs, whether you can dispense the prescription or whether you should not dispense the prescription legally. So without further ado, I'll get started. These are the Office of Controlled Substances Health Canada guidelines and they were last revised in November 2020. And I'm only using this for the teaching purpose. And I'm using this information from RxTX. So without any further introductions or anything, we will just start by what are the different types of narcotic drugs or the controlled preparations that Health Canada put a restriction on, and what is the restriction and how we are going to deal with the prescription if we get a prescription related to any narcotic prep, narcotics, controlled substance, or targeted substances. So we have to think about certain areas. It's like, can we dispense if the prescription is written? Can we dispense if the prescription is only verbal? The next thing would be if a refill is allowed on a written prescription or if a refill is allowed only on the written one and not on the verbal one. And then we will see if a transfer is allowed or not. For other two restrictions, it says that we have to keep the sales and the purchase records of all these categories for 2 years. And the last guideline says that whenever there is any loss or theft of narcotic drugs, we have to report this within 10 days to the Office of Controlled Substances on the address that is present on our forms. But it is important that we keep the record for 2 years of all the five categories I'm going to talk about today. And then we are going to report the theft of all the five categories we are talking. So let's start with the first category, which is actually a narcotic drug. So what is a narcotic drug? Is like one narcotic drug alone. So it should have either a codeine, hydromorphone, ketamine, or morphine. One plus one, so one narcotic plus one non-narcotic agent, as in case of Tylenol 4. Then we have all narcotics for parenteral use. So if you have any narcotics for parenteral, you put them in straight narcotics right away. Then we have any products containing hydrocodone, oxycodone, methadone, or pentazocin. And then we have dextropropoxyphene and Nebulon. So these are all the drugs that Health Canada categorized them in narcotics drugs classification. What are the rules and regulations for this type of drug? Only the written prescription is required for the dispensing, what is permitted for the dispensing. The verbal prescriptions are not permitted. This is important to know. And then refills are not permitted. And whenever there are written prescription, we have to prescribe to be dispensed in divided portions, like part fills are allowed, but refills are not allowed. And then for part fills, we have to keep the copy of the prescription in reference to the original prescription. Then you have to indicate that on the main prescription, the new prescription number, the date of the part fill you're going to do, the quantity dispensed, and the pharmacist initials. Another important thing is transfer is not permitted at all for the narcotic drugs. So this is some main things. These are some main things for narcotic drugs. I told you earlier, records, keep them all for 2 years, report everything. So all the five categories. So don't worry about memorizing these two things. These two things remain same for all the categories. We will also notice that as we go down the classification, the rules kind of get easier. So for them, for these class, just remember that only the written prescription is allowed. Okay, so for the narcotic preps, these preparations, this class is also known as verbal prescription narcotics. It has one narcotic plus two or more non-narcotic ingredient. Remember, for the straight narcotic, we said one narcotic, one non-narcotic. So 1:1. Here we have one narcotic, two non-narcotic, and we also have, like, for example, Tylenol 3 or Tylenol 2, and we also have all the exempted codeine products in this classification. So what are the exempted codeine products? Exempted codeine products are the products that contain approximately 8 milligram per solid dosage form, or 20 mg per 30 ml liquid, or two or more active non-narcotic ingredients. So these three things, either of these three things will be an exempted codeine product. So this part is clear. What are the narcotic preparations? Now we move on to what is allowed and what is not allowed. Because they are also known as verbal prescription narcotics, so rules get easier. In this case, both the written as well as the verbal prescriptions are permitted. But here at now, still refills are not permitted. So refills are not permitted still. The prescriptions can be dispensed as part fills, same as narcotics class. And for part fills, we do everything similar to the narcotic class. So here, transfers are still not permitted. And here it says that exempted codeine products are dealt in a similar way as of narcotics preparations. Okay, now we move on to the third class, control drugs. And control drugs have part 1 and part 2, part 3. So now we will just see the part 1. Part 1, I remember as something starts from A. So I mainly focus on amphetamines. And with amphetamines, you also have methylphenidate. And more specifically, you also have pentobarbital here. So it's important to remember that pentobarbital is narcotic part 1. What about the rules? So now, because the rules get easier, both the written and verbal is allowed. And in this case, refills are still not permitted for the verbal preparations, but refills are permitted for the written prescription. So that's an easier rule here that got easier in the control drug part 1. Part fills are allowed, and for refills and part fills, you do similar. You make the copies, write the original prescription number, the number of drugs you have, like the amount of drug you have prescribed, and the date of the repeat or the part fill, and what quantity you have dispensed, and what are the pharmacist initials. So at this stage, still transfers are not permitted, and then we have to keep the record and report the theft. So after control part 1, we will see control part 2 and part 3. We can take them both together because the ruling is almost similar. So part 1, I told you I take it as A. So amphetamines, then I combine amphetamines with methylphenidate, and then I combine with methylphenidate pentobarbital specifically. For part B, I say B. So it's part 2, I say B, and it's barbiturate, so phenobarbital, butorphanol, nalbuphine. So these are all control part 2, and part 3 are not C's, unfortunately, but they're very similar to C, and they're steroids. So anabolic steroids like testosterone are covered under part 3 here. So what gets easier for them? So at this stage, we already know written and verbal prescriptions are allowed. And for them, the refills are permitted for written as well for verbal prescription if there is an authority that the time of issuance is given and the intervals between the refill is given, then you can actually dispense the prescription. And then you have the transfers are still not permitted, and you have to keep the record for 2 whole years and report any theft to the Office of Controlled Substances within 10 days. Then we have the last class, which is benzodiazepines or other targeted substances. Here we have alprazolam, bromazepam, chlordiazepoxide, diazepam, lorazepam, oxazepam, temazepam, diazolam. And for these ones, so written and verbal already permitted. Now refills for both written and verbal now already permitted. So what gets easier for them is now they have the transfer of prescription permitted only once. What does that mean? it means that you can only transfer your prescription from pharmacy A to pharmacy B once. It means that, let's say I was in a different place, and now I really want to get my prescription filled at a different pharmacy that is closer to my home. So now I request pharmacy A to transfer my prescription to pharmacy B, which is now closer to my home. And this is one-time transfer. I cannot request a retransfer of my prescription from pharmacy B to pharmacy A again, because only one transfer is permitted. So this is what gets easier for the targeted substances at this point. So let's do a quick review. For the narcotics, straight narcotics, only written prescription is allowed. Verbal refills for both verbal and written is not allowed. Verbal prescription is not allowed. Transfer not allowed. For narcotics preparation, it gets easier, and now the verbal prescriptions are allowed, but still the refills are not allowed. For controlled drugs part 1, it gets little more easier now. So you have the written and verbal prescriptions allowed. You have the refill allowed only of the written prescription when the number of the refill and intervals between the refill is mentioned. So then you have controlled drugs part 2 and part 3 when you have both the written and verbal prescriptions allowed. Refills for both the written and verbals allowed when you have the intervals and the number of refills specifically mentioned. And for both these classes, you have transfer still not allowed. And then we have the benzodiazepines and other targeted substances for which the transfer is allowed, but it is allowed only once. Next comes the question how PEBC can test this concept. In the exam, they can give us a prescription. The prescription can have any drug from one of the following examples, and they can ask if the pharmacist can dispense or cannot dispense. So you have to see if the order was written. Okay, so they can dispense. Okay, so if the refill is allowed in this specific category, or the refill was not allowed, and if the transfer is allowed or transfer not allowed. So these are the things that you have to keep in mind. And as mentioned mentioned earlier, and I'm now mentioning it again, that these are the guidelines that got revised on November 1st, 2020. So now the sales and the purchase record of all these categories must be kept for 2 years, and in case of any theft, you have to report within 10 days. I hope this is clear. If you are having trouble or if something is not clear, you're more than welcome to ask, and I'll try my best to make it clear. With that, take care, and I'll see you guys next time. Bye-bye.